Alright, now we're going to begin the protocol review, and we're going to start by going over the basis of your practice. Our protocols are one part of your care. A big part of it is your training, your OEC training, and then what you bring with you in your outside jobs. And there is a scope of practice authorized under Maine law. You can't use these protocols unless you're authorized by the medical directors. And so to become authorized by the medical directors, you have to complete this online didactic training program, and you have to successfully complete the skill stations. At that point, either Howard or I will sign you off as authorized to use the protocols. You will hear references to something called the physician box. It is a box of equipment that we maintain specifically for physicians, either the medical directors on the mountain or through our contract with Eastern Maine Medical Center. We also have the ability for other physicians who practice in the emergency department to come out and provide on the mountain medical control. So they may use those devices that are stored in that box. Generally speaking, and this applies to all patients, every patient needs to undergo and have documented in our patient care report, which we'll talk about at another point, a history. Now, the minimum elements for every history is the chief complaint, the history of present illness, any past medical history, any medications the patient takes, and any allergies. And so you need to document all of those elements on every patient. You need to document a physical exam, the airway status, and that basically means, do they have a patent airway or not? Is it open? Are they breathing? Their mental status, are they alert or are they not alert? And if they're not alert, are they unresponsive? Their vital signs. Every patient needs a pulse, a blood pressure, and a respiratory rate documented. Or if you can't document one of those vital signs, you need to document why you couldn't obtain the vital sign. A general description of the patient, and that's really easy. This isn't supposed to be complex. It's basically the patient is comfortable or uncomfortable appearing, and they aren't in respiratory distress. And then complaint-specific exam findings. I don't expect you to do a head-to-toe exam on every patient, but I do need you to, if they're complaining of ankle pain, document an examination of the lower extremity to include the ankle. So every patient needs to have those things happen, and you need to document that you did them. You may now go ahead and complete the knowledge assessment associated with those parts of the protocols.